Hi, I'm Stuart, Hinds, soft tissue therapist. We've got the wonderful Tess Kersop-Cole here with us. She's our current national under-18 400 metre champion. We're going to talk a little bit about hips. We're going to talk a little bit about restrictions that we commonly see in the hips, especially with our athletes. For Tess, she's had a long history of hip issues. Luckily now at the moment she's got complete resolution, so we're pretty happy about that. The first thing we're going to talk about is obviously hip extension restrictions, which normally we see. I know there's a lot of value placed on the glute max and the hamstrings and even the ipsilateral erector spinae group, but I think a lot of the times we miss the key restrictor, which is basically that hip flexor attachment just onto that lesser trochanter. So we're going to talk a little bit about that and how we release it, and obviously help our athletes in their hip extension, which is extremely important, especially when we're talking 400, 800, even 200 metre runners. So simple process, we're just going to take them into almost like a little bit of a prone knee bend position, bend the knee, obviously at 80 degrees, stabilise over the sacroiliac joint, and just slowly bring the hip up into extension, and obviously finding out what that end feel is like. Now Tess at the moment feels really good, but obviously when she was having issues with her hip, we were getting some deep pulling through the front there, and especially up quite high. So once we've done that, we've assessed that, we'll get them to turn over, and then we'll go through the process of how to release that. Righto, Tess, get you to turn over onto your back. So the first step in releasing this hip extension component is obviously the trigger point that lies just above the lesser trochanter. So if you're having problems finding this point, it's quite simple. Take the hip up into a little bit of hip flexion. If you come over, bend the knee across into abduction and just palpate underneath the greater trochanter. Okay, you'll find the lower edge of that greater trochanter there, and obviously the upper one. Then basically just draw a line straight across from that greater trochanter. You should be on top of the lesser trochanter right there. The trigger point will lie almost 2, or depends on the size of your fingers, potentially even 3 finger widths up from there. So the trigger point will be right there. That is the most key restricted right there. So it's a simple process. We're just going to lean in with a braced forearm and pick up that tender area about there. Is that it, Tess? Yep, we can see. Okay. It's got to be tolerably uncomfortable, not too much, because if we go in too deep, too hard, they'll start to react against us, and that's the last thing we want to do as well. So we just sink in there and wait for that to melt. Now, sometimes that might take 2 or 3 minutes, sometimes it takes longer. Obviously, the more that you work with your athletes, the quicker that obviously releases. So, you know, we had it down to a fine art with Tess. Obviously, within a minute, it used to just release off beautifully. Okay, I can start to feel that just softening off now. Now, the second part to this is really, really important as well, because we then have to address this rectus femoris as well. So I'm obviously looking at using some passive release techniques as well. So I'm just going to come out of there like so. Place the knee into a little bit of flexion. Okay, a little bit of pre-max. Okay, not too much. We want just enough that we can get a nice engagement of the tissue. Work that rectus femoris all the way up to its attachment. Okay, so now we come in with once again, just a braced forearm. Just going to just drag the tissue a little bit medially, and then take up the slack on that skin laxity. So we're engaged the tissue now, and then just working through that tissue and feeling it just releasing under our forearm. Now, if we go too deep, unfortunately, our clients will start to push back against us, and that's, once again, that's not ideal. So there's a little bit of an art to this, just making sure that you engage the tissue properly. Right speed, right depth. How's that feel there, Tess? So as I'm coming up, I'm putting more and more knee flexion into there. And for those of you that are familiar with the trigger points, obviously there's a beautiful little trigger point right at the top of the rectus fem, which refers just spectacularly over the top of the knee. And all the way up. Terrific. So we do about 3 sweeps of those, and usually once we've done that, we turn them over, we can reassess them, and usually you'll start to see that hip extension has really, really changed.